and public health physician Maymunah Kadiri joins us for more on this. Good to have you join us, Maymunah, this hour.
Thank you.
First time we're recording the highest daily number infections in Nigeria with 663. Now, people are wondering, is this because we are ramping up testing, or is this just, does this portray the fact that, look, we have community transmission now?
More of community transmission. We are very far away from ramping up testing, very, very far away. Why? Because a population of 200 million Nigerians, we haven't gotten up to 50,000 people tested. And we are not testing people that are willingly wanting to test. We are testing those with symptoms. So it's a far, far cry from it. But of course, this is community transmission. And if you see Lagos State, 170 as compared to other states, I want Nigerians not to be alarmed with these numbers, with the 663. It's possible we are going to have more. Why? The moment each state buys into increase in the number of testing per day, we are going to have more. There's ease down of the lockdown. And before you start seeing an increase in the numbers, it will take a minimum of 14 days incubation period before you start seeing, you know, lockdown was eased off some days ago or a week plus. So you are going to start seeing this increase because that's when people will start presenting with symptoms. So what we should be looking at in that NCDC report, the death toll, is it increasing? Yes. And why is that? Possibility that people are taking it for granted that there's ease of the lockdown, so they're doing whatever they like without putting precautionary measures in place. So people are going to present to these isolation centers or to hospitals in severe or critical cases as against mild or moderate that they can easily recover
Even when
from.
you don't have underlying ailment.
So underlying ailment is just, you are more at risk, and if you are elderly. But have we had people die below 20 years in Nigeria? Yeah. The figures may not come in there, but the health workers know. It may just be an outliner, but the truth is that we are going to see more of this increase in this rate, as in C63 may just be one of, it's just showing us that there may be a day we'll be having like 1,000 plus or 2,000 plus, if all states buy into increase in testing.
So again, this is while states and the federal government should take responsibility, but there's also personal responsibility here. Yeah. And we seem to see that, you know, people are becoming lax.
Very.
Instead of, you know, becoming more serious with this. But people say that, look, it's because of when you have malaria, people know that you have malaria. When, you know, they can visit you, they see you.
Yeah.
But with these, people are isolated, so it's difficult to believe. So how do we ensure that people really understand what's going on here?
It's a novel virus. Okay, look, let's even go back to World Health Organization. Initially, they say no masks unless you have coughing, you are sneezing, or you are dealing with a direct person who has COVID-19. But now what is happening? Masks everywhere. Initially, it wasn't airborne. Now they're saying it's airborne. Initially, they're saying asymptomatic symptoms can be, you know, transmitted, but they're not saying it is rare. So you see, because it's a novel virus, we'll keep having new guidelines from time to time. But what are the things that are standard that you as an individual should take responsibility for? Social, you know, physical distancing, 2 meters apart, wash your hands regularly with soap and water, you know, use your face mask. If you don't have to go out, don't go out. You know, capacity in every public transport should not be more than 60%. Gathering shouldn't be more than 20 people per gathering. Let's take responsibility, because this is, we are all in it together. People that die so people are not saying, oh no, it's no longer existing. People are not dying. They need to go to isolation. I think people need to know what is really happening in hospitals, that people are dying, that they will come to hospital, they can't admit them because the places are filled up, they have to wait outside for like 4, 5, sometimes 12 hours, and they need oxygen. And do we have oxygen tanks in all the centers? You know what it is in the healthcare system. So truly, the guidelines, the preventive measures, we as individuals that make up the society need to take more responsibility.
And I like that you say this, because this is not to scare people. This is to just make people take responsibility.
Exactly.
But the NCDC has said we're at the beginning of this outbreak with over 30,000. And the Lagos State government has said by the end of July, we might likely see about 120,000 cases in Lagos. So how should we prepare for this as a country if we're just at the beginning?
So, for example, if Lagos State is projecting by July, August that we should have a peak of about 90 to 120,000. What they should do is to get more isolation centers, get the private sector involved, because private sector have a huge number of beds incubating. So if you are not going to put in the general hospitals in the Lagos State so that they can cover all of the medical condition. The private sector has to, they have to be involved. Then home care treatment has to come in. Because all isolation center will not take every case. So home care-based treatment has to set in, whereby you isolate, you take responsibility, then maybe like a home care pack given where you know that this is what you should do, and then if it escalates or you are in severe or critical state, you come to the isolation center. But mild, moderate can be home-based.
Maymunah Kadiri, many thanks for sharing your perspective with us on this issue.
Thank you.